How's it going? I'm Alex. Today we're going to go over cervical posture. Unfortunately, everything we do in life promotes bad posture, from driving, typing, writing. So we tend to have a forward head when we have the bad posture and rounded shoulders. A lot of times if we're typing or even driving, our arms are up here, we tend to shrug the shoulders. So unfortunately, because of this, it starts to create dysfunction at your upper traps, middle traps, and your cervical spine musculature, which that could lead into other issues when you're trying to do activities, when you have to clean, you have to do grocery shopping, you're taking care of kids. So today we're going to talk about certain things you can do at home to help alleviate some of that. One, to begin with, is a scapular retraction. Bring the shoulder blades back. Not only bringing them back, but trying to put them down into your pockets of your pants. A lot of times when we tend to do this, we tend to shrug them up and back. And that just starts engaging the upper traps a little bit more than we need. So again, you want to come back and down like you're tilting. Another thing you can do is an upper trap stretch. And I'm actually going to have Jason stand up. I'm going to have him face. So with the upper trap stretch, you can sit back down, Jason. There's a couple things I like to do with one arm. I like to tell people to either grab the chair, sit on their hand, whatever's most comfortable. Then with the opposite hand, they're going to come and reach over their head and tilt. This stretch is going to get all the way down to the end of the muscle. A lot of times when we have tight upper traps, when we try to create a stretch, we start elevating our shoulder. So this helps isolate that. And again, you want to hold for 30 seconds up to a minute if you can. You don't have to do all of them on one side. You can take breaks. You want to do what's comfortable and tolerable. The second thing you can do is a levator scap stretch. For that, same thing, I tell a patient they can either grab the chair, sit on their hand, or even put their hand on the small of the back. Sometimes this might aggravate the shoulder, so just do what you feel is comfortable. So have you go back. Okay, so now you're gonna, again, reach over. You're gonna look at your elbow and then pull your head down. This is gonna get a slightly different muscle, more towards the back of the neck. And again, what you feel comfortable. If it's only 10 seconds at a time, that's fine. You want to work up to it, okay? So the next thing we can do is a chin tuck. So a lot of people, when they think of a chin tuck, they try to bring their chin down to their chest. It's not really that. It's pushing their head back. It's trying to create that double chin that we all don't want, okay? And again, you want to hold for 1 to 2 seconds. It's not a rapid fire motion. It's more of a control motion. Now, if this is too hard, you can actually do it laying down with a pillow underneath you, okay? Another thing I like to do for mobility is tilt to each side. So we're gonna pretend like his nose is on a swivel, so we can actually have him put his finger on his nose. And then we're gonna have him tilt to the right and tilt to the left. This right here is gonna prevent him not only from tilting, but rotating. So a lot of times when we try to do this, we try to not only tilt, but we try to rotate to try to really work that range of motion. But this is just a small movement. And again, we can do anywhere from 10 to each side or 30 to each side. The last one will be, it's a rotation. So we're gonna pretend like your nose is on a horizon. Nice and level, you're gonna try to rotate to the right and rotate to the left. Okay, and again, we want to start off with 10 to each side or even 5, just to work into the motion. You don't have to go to the end of the range right away. So you always want to remember, you want to stay in a pain-free range. If it starts to become painful, you always want to consult a medical professional. Here at Chandler Physical Therapy, we offer discovery visits, where they're 30 minutes, where you kind of talk to a PT, and the PT can do a little mini evaluation to kind of see if PT is going to work for you for your ailments.